For those persons who are attempting to avoid community advisory points by traveling on foot, for those persons who continue to think that it is okay to visit your friends and your family, for those who are using neighborhood shortcuts and are trying to move around the island and pretend that it is business as usual. I have said it before, and I will say it again. Stop. This is a life and death situation. Your actions can possibly kill others. And you could be potentially spreading the disease as we recognize that they are asymptomatic carriers from one person to the next. And while you may not be impacted, the next person you see, a friend, a cousin, or a loved one, could be impacted, and their families could also be impacted. So it is urgent that we are all incredibly responsible for this time. Also, and it is important to remember that if you do go out, you should wear a mask. There is information on the government's website, coronavirus.gov.bm, on how to make your own homemade face covering. I continue to encourage you to do so. Make a mask at home and wear it wherever you go out. It is important to remember that masks by themselves will not protect you from contracting the coronavirus. What a mask will do is prevent you from spreading the virus to others if you are an asymptomatic spreader of the virus. The general public should not use surgical or N95 masks if possible, as there is a global shortage of these masks and they are best reserved for healthcare settings. But it is important that you cover yourselves up, your face up, when you are going either to the grocery store, the gas station, or out in public. And it's so good to see so many members of the media observing that today here, where I see that all members of the media are appropriately masked. Thank you. In addition to the London Airbridge flight arriving on Monday afternoon, Travel Edge, working with the U.S. Consul General, the Ministry of Tourism and Transportation, the Ministry of National Security, amongst others, were able to bring 63 Bermudians, including many students and seniors, home yesterday. They landed at L.F. Wade International Airport and were transported to a government quarantine facility where they will remain for 14 days. 48 Americans and other foreign nationals left Bermuda for Atlanta on the return charter. The Bermudians who were on the Princess Cruise Line were not on that flight. However, the cruise line will provide 2 charter flights to bring those travelers home. And once they arrive, they will be required to go to a government quarantine facility for 14 days. As I've said from the beginning, there are Bermudians in various parts of the world who are stuck there due to no fault of their own. The London office is responsible for working with Government House and the Foreign and Commonwealth Office to bring Bermudians who may not be in the US or Canada back to Bermuda. If you or a loved one who would like to be added to the list, please make sure that you complete your registration through the government website at which can be found at coronavirus.gov.bm. There is a link there which says forms, and it has the wide variety of forms of which we put online to make sure that government services can continue during this time of remote working. So you can access the form section and you can complete the form and make sure that your name is added to the list. Minister Keynes will provide details of what activities will be permitted on Good Friday. However, I will restate that Good Friday is one of those days when shops, by law, are closed. With the restrictive guidelines already in place around shopping, I've asked the Minister of Finance to exercise his authority under the Public Holidays Act 1947 to allow those permitted businesses operating under the shelter-in-place regulations to remain open on Friday the 10th of April if they wish to do so. Permitted businesses that wish to be open will be open on Good Friday. However, the Minister for the Cabinet Office, Minister Wayne Ferbert, did contact most grocery stores, and they have confirmed to him that they will not be open, and many of them will be closed. I'm certain that the media will report the stores that will be open on that particular day, but it's important to note that many will be closed. However, they were given the particular option. At this point in time, I will hand over to Minister Keynes who will give an update on a number of matters. Minister.
Thank you, Premier. I wish to provide a brief update on matters to do with the joint community advisory checkpoints, correctional facilities, the government-approved quarantine location, the government shelters, and kite flying. The joint operation of officers of the Bermuda Regiment and the Bermuda Police Service continue to work together to ensure the public's compliance. During the past 24 hours, the Royal Bermuda Regiment and the Bermuda Police Service conducted 3,998 vehicle stops and at 25 community advisory points. The combined force has increased the locations and the visibility of the community advisory points, which have now expanded island-wide. We will also see members of the Bermuda Police Service patrolling the railway trails to ensure that these areas are kept clear in accordance with the shelter-in-place guidelines. Again, anyone who does not have a legitimate reason for being on our roads during the shelter-in-place will either be turned back, detained, or even in some cases, as we have seen, arrested and brought before the courts. As it relates to our prison facilities, increased measures have been put in place, including pre-screening of staff prior to being allowed into the facilities. In accordance with the legislative guidelines, visits at the correctional facilities remain suspended. Some of the inmate classes and programs have also been suspended. Corrections civilian staff are now working remotely. Turning to the government-run quarantine facilities. We appreciate that these are testing times, but the reality is that there are some difficult sacrifices that must be made. However, we also appreciate that there are some of those in the quarantine facilities who need specialized items. We have heard the feedback. So in keeping with the grocery store policy or the surname policy, persons who have family or friends in a government-managed quarantine facility will be allowed to drop an essential care package at the location on the Thursday and Friday of this week between 1 and 5 p.m. Next week, the essential care package drop-off schedule will follow the full week surname format. The drop-off time is from 1 p.m. to 5 p.m., no exceptions. The essential care package should have the room name, the room number, and the recommended items should include key necessities such as toiletries, medication, and essential foods, inclusive of any special dietary items. We ask if it is at all possible, in keeping with the guidelines, that one person makes the essential delivery. And now an update regarding the government-run shelter. The temporary shelter-in-place accommodation for unsheltered persons continues to operate at the Berkeley Institute in accordance with guidance provided by the Ministry of Health. The shelter hours are from 6:30 p.m. to 7:30 a.m. This allows time for the facility to be cleaned. Shelter residents are permitted to stay on the Berkeley property, on the field, and the covered lower porch level areas while the shelter is closed to residents. Residents are provided with dinner, an evening snack, and breakfast. They are also provided with a snack and water to carry with them whilst they are out in the morning. To ensure that the critical needs of the shelter residents are being met, as well as the operational, facility, and staffing, there is medical, security, maintenance, administration, and general volunteer support at the shelter. It is anticipated that the shelter will move from the Berkeley Institute to the Cedar Bridge Academy within the next 48 hours. In consideration of the social distancing requirements, the facilities at the Cedar Bridge Academy are more suited for the shelter during the COVID-19 pandemic. Lastly, we know the cultural significance of the upcoming Good Friday holiday. Kites are considered one of the cornerstones of our heritage. But while the breeze may be perfect for pitching kites, and seeing colorful hummers on display in our skies is a heartening sight, even this tradition must be tempered by the reality of our current global situation. We simply cannot do what we instinctively want to do at this time of year. Fly your kite in your own yard and enjoy the day at home, keeping with the regulations that govern our shelter in place at this time. This is not optional. On Easter Sunday, churches will still be closed. However, we expect and encourage religious and faith-based entities to continue to provide their Sabbath and Sunday services and observations online and in online and broadcast mediums. Finally, I will end with a familiar refrain. I'm urging members of the community to please adhere to the guidelines set out in the Emergency Powers Act 2020. For the avoidance of doubt, it is our objective to limit your movement of the general public to prevent the transmission of the COVID-19 virus in Bermuda. If you do not need to be on the roads, stay at home and stay inside. Thank you.
Thank you, Minister Keynes. And before I give my closing remarks and take questions, I just want to certainly pay tribute to the minister and the other government ministries, such as the other government departments who assisted and worked to ensure that there were additional shelter options for the vulnerable in our community. It has been a particularly challenging effort, recognizing the public health circumstance which we're in, but the minister has been determined to ensure that the vulnerable have somewhere to stay, and I want to personally recognize his efforts in that regard, because it has not been easy. As a reminder, if you have questions or concerns about COVID-19, you can call the helpline at 444-2498. The helpline is receiving, on average, 230 calls a day, many of them around the shelter-in-place guidelines. If you have a question, please make sure that you can go to the government website, where you will find a lot of answers to your questions. And that, again, of course, is coronavirus.gov.bm, and I think that is displayed below me. Additionally, you can sign up for the government's WhatsApp, where you can send a message to subscribe for information, news, and official updates. To sign up, all you have to do is WhatsApp HI to 504-6045. Again, that number is 504-6045. And make sure that you add the number to your contacts list so that you can receive messages and updates directly from the government of Bermuda. I will conclude my remarks with my customary thank you. Yesterday was World Health Day, and I will voice my deep appreciation to every healthcare professional who is on the front line in making sure that Bermuda is effectively dealing with the COVID-19 pandemic. To every person who works in public health, to every doctor and nurse working in the hospital or out in the field, those in private practice or elsewhere, your work and dedication to the health and well-being of everyone in Bermuda is appreciated. I encourage everyone in Bermuda over the next few days to send a message of appreciation to a healthcare professional, as they are the true heroes of this pandemic. Before I end and take questions, of course, I'd like to again please ask the country to pray for the family who have lost a loved one today due to this pandemic, and reminding everyone that we all have a role to play to minimize the worst case scenario, which none of us want to see here in Bermuda. Thank you.
Minister Golson, I'd like to ask you two questions. Are those persons that have been tested positive for the COVID-19 virus, are they being retested after the 14-day period is up?
At this point, the answer to that is no. As the Chief Medical Officer has explained previously, those persons that test positive for COVID-19 are required to isolate, and upon the conclusion of their isolation period, which is either 14 days or 3 days after their last symptom, then they are deemed to have recovered. So whichever of those two dates is the latest in time, then that's the period in which their isolation is concluded and they're deemed to have fully recovered.
TNN understands that, as you stated, some test kits have arrived, but I've been told that laboratories are having a shortage of reagents, some solution that's supposed to find out if it's yay or nay. They're having issues. Is that anything you might know of?
The reagents, there is no shortage of reagents. We do have some limited supplies with respect to the swabs. However, we have sourced those, and we are looking again to continue to receive as much testing materials as we can. As you've heard previously, the Premier has directed that we test, and in that regard, we are sourcing as much supplies as we can. You would have noted that we did receive supplies on the BA flight on Monday gone, and we're still anticipating further supplies from China and other areas in which we've sourced. So the objective, as the Premier has indicated previously, Trevor, is to do aggressive testing, and we've seen the results of that in other jurisdictions, and Bermuda intends to follow suit. We have the first real-time PCR machine outside of CARFA. Cayman has one, we have one, and we are in the process with the recent arrival of Dr. Weldon and the PCR real times that she was able to acquire and bring with her physically. She didn't carry them herself, but they were on the plane. On Monday from the BA flight, that lab is also being constructed, so to speak, because there are some requirements from PAHU with respect to ensuring that the lab facilities meet the international standards, and that is being done as we speak. So we will have certainly sufficient capabilities to meet the mandate of the Premier and the government, which is to test.
Thank you. Minister Keynes.
Trevor, before you go to the next question, although the minister did state it yesterday, I just want to clarify for the record, certainly that Dr. Weldon remains in quarantine and is directing all of these things, or assisting from her hotel room.
Thank you very much for that little plug. Minister Keynes, question, why is the Bermuda Regiment guys that are on patrol during the roadblocks, why are they not wearing protective masks and gloves, etc.?
By tomorrow morning, everyone should be in protective masks and gloves.
I'm not sure if you have been aware that a particular member of the judicial system was refused to present ID today at a ridge checkpoint, and this individual was quite upset that the regiment soldiers did not know who she was. Are you aware of this issue?
I am aware of the incident.
And okay, what happens when people of authority are not abiding by the rules and regulations?
The rules are for everyone. When I go through a checkpoint, if I'm asked for my ID, I present my ID. No one is exempt from it. I'm aware of the incident. The incident was handled at the scene. Mm-hmm. His Excellency the Governor and the Chief Justice have been notified of the incident.
Another question, with kites, with Good Friday coming up this weekend, what happens if someone is flying from their yard, the kite goes down 300-400 yards away? What is the protocol for this person?
It's actually a very good question. So let's just go by, we all understand the traditions that we have around kite flying. We are under a shelter in place. The beaches are closed, so we have a tradition of everyone going to Horseshoe Bay, people going down to PHC, people going to the Somerset Cricket Club. All of those and those situations are canceled. Everyone is under a stay-at-home order. If you have a kite, you are allowed to fly the kite in your own yard, in your garden. If the kite goes outside of your yard, or if it goes anywhere outside of your yard, abandon the kite and leave it alone.
That's it. Cheers. One last question. I'm hearing that a number of essential workers are going to grocery stores and are abusing their privilege, refusing to show ID, and being very inconsiderate for those that have been in line for quite a while. How do we put a handle on this situation?
I think this whole concept of shopping, the recommendation to shop by your last name, people being stopped at checkpoints, this is something that is not normal to us. We're expecting for everyone to be mindful that going through the checkpoints, it is a bit unnerving at times, and it is also something that we're getting used to. We're asking everyone to respect the checkpoints and specifically respect the system that we have at the grocery stores. It is simply to protect us all. We're asking for essential workers when they come to the grocery stores to present their ID, to speak with the manager on the scene, but we're just not going to have everyone guarding the line. We're still expecting decorum to prevail.
Thank you.
Mr. Keynes, we understand that some of the people who have recently arrived on the flights from overseas may have been minors under the age of 18. Can you confirm if they are at the government quarantine facility, or whether they have been allowed to return home? And if the latter, can you say what measures are in place to prevent any spread?
There were, so the guidelines, people that were under the age of 18 had the opportunity to quarantine at home. There are legal reasons where obviously they cannot be in the facility. There are, I think, 2 people that indeed went home. I'll get the clarification from the Minister of Health. There were 2 people that went home. They obviously will be quarantined at home. They will be regularly checked by members of the Bermuda Police Service and members of the Bermuda Regiment.
Mr. Premier,
No.
Okay.
Just for your edification, though, under the legislation, there is exemptions with respect to the requirement to quarantine, and one of which is under the age of 18 because they're minors.
Mr. Premier, we understand that there may have been a death of a Bermudian overseas in Panama. Is that the lady that you're referring to?
Yes.
What steps is Bermuda doing to keep up to date as far as Bermudian deaths overseas?
I don't think there's any steps in which we're taking overseas. I mentioned that because I don't want the Bermudians in Bermuda right now who are mourning the loss of their loved one to think that the government only cares about Bermudians who pass away here, and I mentioned that. The Minister of Tourism and Transport has been in touch with the family to discuss options about possible repatriation of remains, and so that is a discussion that will be held with the family. But for us, it came to our attention, and I was informed yesterday, and I wanted to make sure that I extended the condolences of the government and the people of Bermuda to that family.
Now, sir, you mentioned earlier in the press conference the worst-case scenario of 700 people succumbing to this on the island. In light of that, are you considering any stronger measures to help discourage people from leaving their homes, stricter, harsher penalties, for example?
I'm not entirely certain that we can remain locked in place for the next 18 months, and I don't think that that's something that is feasible. I think that as this, because this was a novel virus when it was, first reported back in December, we're learning more and more about the virus on any given day. Each week brings new advancements. More months will bring new treatment, different ways to identify the spread, new testing methodologies that are rolled out, increased capacity, increased PPE, et cetera. So for our focus in this 2 weeks of shelter in place is, number one, to make sure that persons stay inside so that we can reduce any possible additional transmission which may be taking place locally. That's the first and most important thing. Number two, if persons are following the rules and regulations, we'll never get to the worst case scenario. The worst case scenario is if we do nothing, this runs through unchecked through our community, et cetera. That is not where we are. But it's important for persons to recognize how bad it can be if we do not do what is necessary and required. This is not a joke. This is not the flu. This is something that is certainly more serious, something that is certainly more contagious, and something that, if left unchecked, could have serious consequences on the island. So from our perspective, what we're wanting to encourage, and for us, of course, it's a little bit worse. And I say it's a little bit worse because we do have an older population, and the risk factors, which are more prevalent for persons who can suffer from this disease, are very present inside of our community. So it is critically important. So the government, the cabinet, is meeting tomorrow. We will consider the latest modeling information. Those things will factor into decisions that will be made as we go forward. But I think that it's important, and I shared that information today so people know and recognize and understand that this is not a joke. And if you care about your family, or if you care about the families of others in this country, you will listen to what has been put out. And for us as the government, we'll use these 2 weeks. We're going to continue to figure out and adapt our strategies. You recognize that we're adapting as we go forward. It is a fast-moving situation, and we're going to have to figure out how we're going to continue with some semblance of life and some semblance of an economy while we adjust and take into account the realities of a novel virus, which has proven to be very destructive to many communities around the world.
Now, you did mention the economy. There are a lot of people in the island who are very concerned about the economy and how Bermuda is going to bounce back. What are your feelings on that?
Well, I've spoken about that before, and I'm happy to speak about it again. The fact is that the recession that is coming may not be like anything we have seen before. That is a fact. And that is the reason why, when the Minister of Finance and I today had a conference call with the Bermuda Chamber of Commerce. We are continuing. He's going to be speaking shortly on what he's putting together in regards to a stimulus package for the country for after this, and people should be concerned. Absolutely. Things are going to have to change, and that's why on Friday I use my remarks to, number one, remind people of the difficulty that is to come, but number two, also remind persons to take some time over these next 2 weeks that you're at home to build yourself, learn a new skill, take advantage of online resources, do those particular things and get ready. Because as we move forward, we recognize we have a decimated tourism industry that we're going to have to work very hard to get back. We're going to recognize from the perspective of cruise ships that it's going to be an industry that many persons rely on in Bermuda that may not be able to function as it was this year. So there is going to be a lot of challenge. And it's important that people take this time to build themselves and to take advantage of the resources which are offered online, because it is critically important for their future.
Don Burgess, Bermuda Broadcasting Company.
Can't hear you.
In terms of population of 64,000 people, how would you characterize the number or proportion of tests that we've carried out so far?
Don, I guess I would say I don't have a comparative figure of all the countries around the world, but I'm certain that you know the number of tests in which we've done, and I'm sure that you can refer that to our figures and make the comparison, certainly.
You talked a little bit about the modeling stats earlier.
Sorry?
Sorry, you talked about the modeling stats a little bit earlier. Based on those figures, on a best case scenario, when might we peak, or when might the modeling suggest that we might peak, and what sort of numbers and total cases might we expect?
Yes. Don, as the Premier spoke about, we did have a meeting this afternoon, and later on this morning and this afternoon with the Premier. The modeling is actually based on the Public Health England and Imperial College London, and we have looked at the modeling and have affecting strategies. We will actually be able to complete the local modeling is being finalized as we speak, and that'll be shared with the public. I think the critical point to emphasize is that in the absence of any mitigating factors, such as what we're doing now with respect to the shelter in place and the other types of social distancing and other measures that we've spoken about, in the absence of that, what we will likely see based on the modeling is a surge, and we will see a spike in the amount of persons that are test positive for COVID, and more importantly, persons that require hospitalization, and that will crumble our healthcare system, which is why we are taking steps so that rather than seeing a surge, we can see something more like this insofar as the increased cases, but they're happening over time, over a series of months, where our most vulnerable persons are protected, where our younger, more spry citizens may very well get asymptomatic symptoms, but be able to help with our herd immunity and the like. But what we don't want to see is an immediate spike upwards. And the only way, the best mitigating factors, as we spoke about yesterday, to prevent that is what we're doing now with respect to sheltering in place and the other type of mitigating factors that we've been speaking about concerning social distancing, proper hand hygiene, and the like, which again, if I can just, not to repeat the Premier's point, but it's critically important because we can avoid seeing a surge that will overwhelm our healthcare system and cause, more importantly, more deaths if we all adhere to the requirements with respect to the sheltering in place.
The Premier, again, he mentioned 700 people on a worst-case scenario. How many people would actually have to be hospitalized under the worst-case scenario?
I think what the minister did say is that I've given that as a broad and overall example. I think the minister did say that she's finalizing the items, and you did say that will be released, correct?
Sure.
Yeah, so it'll be released to the public. So once it's finalized, then we'll be able to release all of that modeling information. We're not going to keep it to ourselves. But I wanted to make the point today of the information that has come to me as part of this report to reiterate. Because, Don, it does seem that some persons in the community are not getting the message and think that this is just the time to try to continue business as usual. It is not.
Okay. Based on those things, and you know, if people do what they should be doing, how might that affect our exit strategy from the lockdown and then easing off the restrictions?
We're going to look at the information as it comes. The Minister of Health has said that the model will be updated, and we're going to take it on a week-by-week basis. That's the only way that you can do it. I have no expectation to extend the shelter in place. I don't. But if we come to a situation next week where we do not have a controlled situation, all options are on the table. I am going to act in the best interest of saving lives in this country, and that is what the government will do, and I think that's what the people of this country expect the government to do.
Right. I'm trying not to make this a political thing, but just as an information thing for the public. The government has proposed a new health plan. How might that affect what's happening now if that was in place instead?
I'm not entirely certain that that would have any particular impact. I mean, it's a virus. The virus would be here, and so from that particular perspective, the treatment that takes place in the hospital and inside the community would remain the same.
Can I just add to that, Don?
Sure.
Actually, because if we did have universal coverage, then many of the questions that we're hearing from persons that are underinsured or uninsured as to who's going to pay for my test kits, who's going to pay for my telemedicine, who's going to pay for my medication, et cetera, which are reasonable questions to be asking if we did have universal coverage, as we are proposing under the Bermuda Health Plan, and those type of questions would be moot.
And finally, Mr. Premier, glad to have you back today. I know the whole nation was praying for you to have a day of rest and to get better. How are you feeling today? Did you get the rest that you needed?
I got enough. Could have had more. I didn't get out of my bed until about 12:30 yesterday, so that was a nice, good bit of sleep. And thankfully, my wife and children let me sleep all that time. But I'm fine. But the fact is that there's a lot of people who are working. So just as I'm tired, and as I had said on Friday that the Ministry of Health gave their staff some time off this weekend, Minister Keynes needs to take some time. The Minister Keynes needs to take some time off as well. I know that his Durham team have a rotating schedule where they give someone a day off. I mean, it's hard. And as the Minister of Health has expressed before, this is a marathon and not a sprint. This is going to be with us for some time, and it's going to be a new normal. So as we continue to adjust, there may not be daily press conferences, there may not be other things. The facts are that what we want to do is make sure the public is as informed as possible, and we continue to get that information and share it with persons. But it's important that the public knows that everyone is working hard, and it's not just me who's tired. It's a whole lot of people that are, without question, exhausted, whether they come from public health or frontline officers that have been working on this for a very, very long time. And the tribute that I have to give to them remains, because they are going above and beyond, sometimes in thankless jobs, making sure that the country can continue to operate, even though we are all sheltering in place.
Just, I guess, a final bit of news, because my cousin's on the flight. The people who were on the Coral Princess have landed at the airport, so
Okay,
they're
excellent.
back home.
I'm happy to hear that, and I hope that, well, they've endured quite an ordeal not being able to get off that boat for a while, and now they're going to go to some of our finest facilities to remain another 14 days of quarantine. But I'm sure they're happy to be back here on the Rock.
Thank you.
I have one last question for Minister Kim Wilson. In reference to the hospital, how are they dealing with supplies? How's the supply kit, the backup kit, the PPE? You have an update on how they're faring?
From my discussions with the hospital today, actually, as is the case, unfortunately, worldwide, there are limitations with respect to PPE, so they are conserving them. They haven't had a situation where I don't believe there's a requirement for the entire hospital staff to be utilizing them. However, if the circumstances change, then there will be a need. There are quite a lot of supplies that are currently housed in our Southside facility that have supplies that we've ordered previously, as well as we've got supplies, as you've heard, en route from China. So there is quite a substantial amount of supplies, not to say that there are not going to necessarily be concerns if we utilize them and waste them, which is why we're obviously have to be very careful with respect to the extent of the supplies and not wasting them, hence the Premier's comments with respect to the utilizing of face masks. We don't want people to run out and buy the N95s and the medical grade masks so that we can reserve those for our medical personnel that need them, as opposed to just utilizing the cotton ones like you have. Exactly.
Thank you much.
All right. With that, I want to thank everyone for their attention. I want to ask all members of the community to continue to be vigilant and continue to remember that it's all of us individually who will make a difference. The modeling information in which I revealed today may scare some, but that is the worst case scenario. That is if we do not do what we are supposed to do. If we all play our part, if we all follow the rules and regulations, if we all maintain our social distance, if we all make sure that we do not come into contact with our vulnerable populations, then we will not have that worst case scenario, and we will be able to fare better in this, with this pandemic. So for all those persons that are working, for all those persons that are following the rules, for all those persons that are toiling on the front line, the government of Bermuda, the people of Bermuda, and I thank you. Have a nice evening.